Hello, everyone. Welcome back. This is the second of a series of seminars that we have put together for you related to the mental health challenges associated with COVID-19 and beyond. Uh, my name is Adol Korkor, and I'm the founder and the CEO of AB Korkor Foundation, which is really centered around addressing the issues of mental health in our society. The flagship of our foundation is an event that we call the 550-50, which is really the purpose is to raise awareness, to reduce the stigma, and enforce the role of exercise in mental health. Uh, so the first year we had it done was in 2018 and 2019, but because of the pandemic with COVID-19, we had to move to a virtual event this year. Fortunately, many of you have been supportive and have participated, and so thank you for all of those who did. But those who have not, you still have time. We extended your ability to participate until the 14th of June. So you can log into our website, 55050.com, and sign up for the Reimagine Run, and that would be wonderful. You will help yourself and help us move forward with our mission. These series of webinars that we have put together for you really are all-encompassing, and it addresses many facets of mental health issues. And the first one was a topic related to exercise and mental health, which was presented by Dr. Bartholomew, which we had a wonderful reception and great discussion associated with that. And today we are so privileged to have Dr. Jon Lehrmann, who is the professor in chief of the Department of Psychiatry at the Medical College of Wisconsin. We had some challenges with connecting with him on his computer, so he's also joining us on his phone. Thank you so much, Dr. Lehrmann. Tell you a little bit about Dr. Lehrmann. He's had extensive research. He's done a lot of extensive research and publications related to mental health issues, and particularly those of anxiety, depression, and addiction. This is a topic that is near and dear to our situation today during this major pandemic. The sense of isolation, the sense of social distancing, and all the issues associated and with that has really compounded upon the already significant epidemic of mental health issues in America. So we really are privileged to have Dr. Lehrmann here to discuss this with us. A few housekeeping event I want you to know. On the right hand of the screen, you have chat, so you can actually chat with us. But the questions are addressed at the bottom. You can send them to us, and I will review them and then pass them on to the speaker. You will be able to view, if you registered, you will be able to view this presentation at any time or previous presentations. If you have not registered, those presentations at the end of the fourth seminar next week on Wednesday will be available on our website, Facebook, on YouTube as well. So, Dr. Lehrmann, thank you so much for joining us, and I look forward to your presentation. And now, let's go.
Thank you very much, Dr. Korkor. I really appreciate everybody joining us today to talk about mental health amidst the COVID-19 pandemic. I also really appreciate what the Korkor Foundation has done and what it's doing to help support people in their well-being and their mental health. So as Dr. Korkor said, I'm a professor and a psychiatrist at the Medical College of Wisconsin. It's a pleasure to be with you today. I apologize that I'm just holding my phone, so I apologize for the quality of the of how all this is working, but I hope it'll work well enough for you. I just want to remind people to mute their phones and or their computers while I'm speaking, so that this best works out for everybody. So I'm going to be talking to you about how to maintain mental health in the midst of the pandemic. And just so you know, I lead a group of psychiatrists and psychologists at the Medical College of Wisconsin that are very active in helping people with mental health conditions, and are staying very active. And we've pivoted to doing all telemental health for our outpatient care. I also work at the Milwaukee VA, where I have a leadership role, and we too are doing outpatient mental health. And with the COVID-19 pandemic, there's more mental health challenges associated with this, and it really is a tsunami of mental health challenges that are coming on the back end of the actual COVID-19 pandemic itself. Next slide, please. So those are just our objectives. Next, please. So what are the challenges and what is the impact of COVID-19 on behavioral health, mental health? And I'll use mental and behavioral health interchangeably. First of all, there's extremely high levels of stress. And I'll talk a little bit about this this afternoon. There's a sense of a lack of control. And it might have even seemed funny to people how everybody was running to get toilet paper and how we had a toilet paper shortage. But that was the response to people feeling things are out of control. And one of the best ways of controlling things is taking care of ourselves. And believe it or not, psychologically in our own development, one of the first things we learned to control is going through potty training. And so I wasn't surprised from a psychodynamic perspective that that's where people focused. Of course, we don't want to be caught with our pants down, literally, so to speak, and be short of toilet paper at a time when there's shortages and there's this huge crisis. And so there's no surprise from a psychological perspective that that's where people went. But that is a very stressful thing, to lose control. Also, the social isolation that's been required to deal with COVID is not good psychologically. We're people, most of us need people. We all need people, but most of us do to a great extent. And so to actually be isolated and it's very stressful and very hard on us. Obviously, unemployment. I mean, people have been furloughed or people have lost their jobs. And I think it's getting close to 25% of our country is on unemployment now. And that's very stressful. Or facing the risk of that, seeing that happening all around us is very stressful. Homeschooling, that's something where we're having to pivot to work from home to keep things safe. And then we're having to do homeschooling or not have daycare. That brings about great levels of stress. And then there's the actual stress of fear of getting this disease, because it is life-threatening. It's a real risk, and it's a killer. It can kill people. And then fear of getting it and spreading it to our loved ones who could die from it. Those are tremendously stressful. Then there's the loss. I've heard of COVID-19 being called the pandemic of grief, because of all the loss associated with it. There's the loss of life, there's the loss of jobs, there's the loss of us living the way we were living, loss of relationships, or at least the ability to connect with people the way we were previously. And then there's the loss of all the celebrations that we would have, the loss of of sports, the loss of things that we value in our lives, arts and sports. And then there's the loss of, for our kids, if you can imagine, for adolescents, losing a season of soccer. Maybe it's your varsity season. Losing, various things that we value, going to concerts. So there's just so much loss associated with this, and how do we deal with it? Next slide, please. With COVID-19, there's increased traumas. Post-traumatic stress disorder is an illness that I'll talk about in a little bit. About it has to be caused by a life-threatening situation. Well, that's what this is. This is a life-threatening situation. Stress can trigger and exacerbate anxiety disorders. So people who previously had anxiety disorders, all the stress around them is more likely to exacerbate that. Also, depression, if you have a history of depression. All the loss is associated with increased depression. Increased addiction. Many people run to substances including alcohol, to help distance themselves from the stress. It numbs things. Well, that leads to increased use sometimes, and increased use leads to increased addiction problems. We're seeing alcohol use greatly increased. I think 26% increase in sales of alcohol, and opiate use is being increased too as people try to distance themselves and cope and numb in these maladaptive ways. We're seeing increased suicide rates. We always routinely do when there's a downturn in the economy. Well, this COVID-19 is being associated with a downturn in the economy. Right now, for example, Australia, they've reported more suicide deaths than COVID deaths this so far since the COVID epidemic started. So their suicide rates are 50%. That is something I'm very worried about here in the United States. I think we're going to see a surge in suicide rates. We are starting to see that now, and it's very concerning. And then there's also increased rates of domestic violence as people are forced to be home in close confines with their family. And if they're not coping well, if they're not dealing with stress well, they're more likely to struggle with angry outbursts as their tempers flare. And so that's something we have to watch for. Next slide, please. So some of the tips for coping with COVID-19, I want to cover some of them. First of all, we need to try to keep to a daily routine. Get up at the same time every morning. Take care of yourself, your shower, brush your teeth. Do the things that you normally have done. That helps you feel more in control. That helps you feel better and decreases anxiety. We need to be careful. A lot of people, when they're home more and doing this, they watch TV more. And as you watch the news more, that is anxiety provoking. And so it can really pile on. When September 11th occurred, there were a lot of people who were struggling because they kept watching the towers go down again and again. Well, if you keep watching the news and keep seeing the death rates going up and up every day, multiple times a day, that is very stressful and it's not a healthy thing to do. Maybe watching the news once a day is reasonable, but we've got to be careful of that. We need to follow our sleep hygiene rules. What are those? Those are sticking with a sleep routine, going to bed at the same time every night. Many people during this pandemic are staying up much later and then sleeping in and getting their whole sleep cycle off, and that really disrupts things. If you can't sleep, get up and do something that's productive and then go back to sleep when you're tired, but still get up at the same time in the morning. Try not to take naps. Watch out for caffeine use and alcohol use in the evenings. Even though alcohol makes you sleepy, it also really disrupts your sleep, decreases your dreaming time, your REM sleep, and makes you much more restless, and it's not a good sleep. And caffeine keeps you up, so you've got to really watch out about those. Regular exercise is important for your health in so many ways. Dr. Korkor really talks about this and emphasizes this, but it's also important for your sleep. If you exercise daily, and that can be a long walk, or even doing exercise or exercise routine in your condominium, in your home. But you need to do regular exercise. It's really important. You need to stay connected with your friends and loved ones. Use your telecommunications and social media to stay connected. But you got to be careful of not getting too caught up in that where you're doing that all the time, because you need to also have in-person connections with your family and closest relatives that you're living with. You need to do self and home improvements. That's something that's really been valuable. I know a lot of people have, redone their kitchen during this time when they're on a furlough. Or one person I know is taking a special course to get certified in conflict resolution and negotiation to improve his business skills. So I think we should all be thinking about this and taking an opportunity to personally grow from this if you can. And that's a good way to cope with this. Take advantage of the opportunity to be with your family more, but find ways to spend quality time together. And that's challenging, but it can be worthwhile. Next slide, please. Of course, we need to try to stick with a healthy diet. I mentioned it already, but watch your alcohol intake. We're going to be more prone to using it more because of the stress. Do not, well, I already talked about not watching too much news. Process your feelings with your friends and your loved ones. But there is help out there too. For work, you can go to your employee assistance program if you need help. But you can also seek help through telemental health. Our mental health care providers are very active in giving this. This has not been shut down, and you can get it in the safety of your own home now. In fact, Center for Medicaid and Medicare and the federal government has approved full reimbursement for telemental health, just as if you went in person. So what I'm saying is that it's something that's covered by insurance. So it's a reasonable way to get it. I've provided telemental health years ago in the VA system, and it's very effective. Next slide, please. With all the losses that are occurring with this, the actual losses, the loved ones, the jobs, the celebrations, the varsity soccer season, there's also perceived losses, loss of freedom because you just can't go out and do the things that you were doing, loss of community. But there's also anticipated losses. Many of us took a big hit in our retirement fund, and we may not be able to retire early, and we may lose our retirement plans. So we're anticipating that, and so those are all very hard on us. Next slide, please. These are just the 5 stages of grief. When you have losses, we all go through grief, and the first stage of grief is denial. Second is anger. Third is bargaining, where we're trying to deal with God or even the world around us. Next is depression. So we do go through a phase of some depression. It's not the full clinical depression I'll talk about in a minute, but you feel depressed and down. And then finally, we get to acceptance. When we lose a loved one, it can take 6 months or a year to really work through these symptoms, these phases productively. And it doesn't mean you'll ever get past missing your loved one, but you will be able to move forward and not get stuck, and you'll get to more of a level of acceptance where you remember the great times you had with your loved one. But we go through this grief with all of our losses, and so we're going through a lot of grief right now. All of us are, and so it's something to pay attention to. But we need to work through these feelings with our friends and loved ones. The physical symptoms of grief, next slide, please, include fatigue, nausea, trouble breathing, trouble sleeping, and physical pain. Next slide, please. To work through grief, it really, you need to give yourself time. You need support from your loved ones and your friends. You need to have somebody who says, I understand, or that must really be challenging for you, and is willing to listen to how it feels, how you're feeling, how angry you are, how sad you are. Be kind to yourself during this. Expectations, don't have the highest expectations for yourself as you're working through grief. Honor your loss, and there's different ways to honor your loss. And acknowledge the pain that you have, and it's okay to talk about that. Next slide, please. It's helpful to engage in activities that bring you peace. Maybe that's engaging in nature. Maybe that's gardening. Maybe that's, for everybody, it's different. You need to develop a personal way to memorialize your loved one. And there's lots of ways to do that. Focus on your own healing, and reach out to those who have had similar experiences. You're not alone. Just about everybody has lost a loved one previously in their life. But right now, most of us have been touched already by losing somebody we know from COVID-19. Next slide, please. There are barriers to working through grief. I mean, if you're drinking too much, you're not going to go through those feelings, and that's going to slow the grief process down. You need to give yourself time. One of the barriers is not being able to have funerals, so we can't socially support each other as much. So if you know somebody who's lost a loved one, reach out to them in other ways to support them. You can't in person, perhaps, but you certainly can in other ways to connect with them and offer your support. That's what they need. And then social isolation is a barrier as well. Next slide, please. So when should someone get help if they're getting complicated grief or getting stuck in the grief process? When they start to have excessive guilt about the loss of their loved one, then they need help. If they start to think that they would have been better off dead themselves, or that they should have died instead of the loved one, If they're starting to have difficulty trusting others, if they can't perform their normal activities, then they need help. Next slide, please. So one of the things that complicated grief can lead to is major depressive disorder. And I'm going to real quickly go through the symptoms so that you can recognize them. The illness itself has a lifetime prevalence of about 15%. It's twice as common in women than men. If you have a family history of it, you're more likely to get this illness. The mean age for this illness is 40, but that's deceiving because it means it can occur anytime during your life. It occurs oftentimes in adolescence and childhood, but also it's very common late in life. There's an increased occurrence of major depression when we've had a major loss in our lives, but it occurs in all socioeconomic classes and races. Next slide, please. For this illness, which is a horrible illness, and this illness by itself causes more suffering in our world than any other illness, including cancer. Untreated, it can last 6 to 12 months. Treated, we can get it to resolve within 2 months. The risk for reoccurrence is about 40% within 2 years after the resolution of the first time that somebody has it. But about 85% of people who have had major depression will have a recurrence sometime later in their life. So oftentimes it does recur. Next slide, please. These are the symptoms. Major depression involves a change in sleep pattern. So usually it's decreased sleep, early morning awakening, but it can be increased sleep. A change in appetite, usually it's decreased appetite, but it could rarely be an increased appetite. Decreased energy. Suicidal ideation. About 2/3 of people, while they're in the midst of a major depression, will consider suicide. About 10% of people with the diagnosis of major depression sometime in their lifetime will die from suicide. Anhedonia is a word that means inability to enjoy things. Includes a decreased sex drive and just inability to enjoy things that one once enjoyed. Decreased concentration and memory, decreased mood or depressed mood. Next slide, please. Feelings of worthlessness, helplessness, excessive guilt, irritability, tearfulness. Sometimes somebody can have hallucinations or delusions and become psychotic. If somebody has 5 or more of these symptoms ongoing day after day for 2 weeks or more, they meet the criteria for major depression and they need treatment. So when somebody's grieving, you'll have some of these symptoms on and off day to day, but not every day, all day, 2 weeks in a row. So that's the difference. If it starts to become they're so embedded and you can't get out of them and it's day after day, moment after moment, then you need help. Some things to watch for in a loved one who might be experiencing this, or a coworker, if they start isolating, if they're always tearful, if they aren't doing the things that they used to do, if there's less productivity, increases in errors, they're falling asleep, then something might be wrong. Next slide, please. I'll talk about alcohol use disorder. It's something that's very common in Wisconsin. Next slide. Prevalence for this illness is about 10% of us sometime in our lifetime will have an alcohol use disorder problem. It has equal prevalence between males and females. The age of onset can be any time in life, but usually it's after teens and late life. No racial difference in prevalence. Next slide. What happens with alcohol use disorder is people are drinking, they start to drink more, then they have a problem. Maybe they have a DUI, driving under the influence charge, or they lose a job because they're drinking, but yet they keep drinking heavily. That's when it's clearly a problem. That's how we diagnose it. And what happens is they start to use more and more and use higher potency products. And that is kind of a gradual increase, and that develops a physical dependence. They develop a physical dependence on alcohol, where if they're not drinking it every day, they start to go through withdrawal symptoms. And that can involve tremors and sweating and feeling irritable, and also can lead to elevated pulse and blood pressure and temperature. They also develop psychological dependence, and that's the inability to psychologically stop or cut back. And so if they can't cut back, that's not a good sign. If you yourself can't cut back, you need to pay attention to this. Withdrawal symptoms can get really severe and lead to delirium tremens and seizure. Delirium tremens is a severe form, and it could lead to death. untreated. Next slide, please. Alcohol use disorders can be lifelong disorders. Often recurrent exacerbations occur. They can be life-threatening, as I said, and they have alcohol has a negative physical effect on every organ system in the body. It affects the brain and can cause dementia. It causes ulcer disease in the stomach. It causes muscle wasting. It causes liver inflammation. It can cause cardiomyopathies or heart arrhythmias. So it's really a toxic drug when overused consistently. What you look for somebody who's a coworker or a family member: change in productivity, slurred speech, smelling alcohol in their breath, decreased coordination, irritability, drinking in the morning, volatility, isolating, and poor attendance. There's a 10% lifetime suicide risk with alcohol dependence as well. Next slide, please. Other addictions we've got to watch for too. Opiate use disorder. Believe it or not, in our state, the last several years, we've had approximately 800 deaths a year from accidental overdoses on opiates. Did you hear me? 800 deaths. We've only had just crossed 500 deaths with COVID. We have more deaths than what we've had with COVID in Wisconsin each year from opiate overdose deaths. And that's something that's kind of getting forgotten in the background. We've got to keep our eyes open for this. We've got to encourage these people to get help. There's stimulant use disorders, sedative use, THC. Any of these drugs can have negative effects when overused. We need, again, things to look for: change in productivity, slurred speech, decreased coordination, irritability, isolating, poor attendance, similar presentations. Next slide, please. Post-traumatic stress disorder. I mentioned that this is an anxiety disorder that can occur when people have life-threatening stressors. And certainly COVID-19 can be a life-threatening stressor. So lifetime prevalence for PTSD pre-COVID was about 4% for men and almost 10% for women. Much of the increase for women is due to sexual trauma, unfortunately. Mean age is early 20s, but it can occur at any age. It occurs in all races. Somebody needs to be exposed to a potentially life-threatening situation. Next slide, please. The symptoms of PTSD, post-traumatic stress disorder, are three different classes of symptoms. One are the reliving symptoms, which include nightmares, the trauma, recurrent intrusive thoughts of the trauma, and flashbacks. Also, there's avoidance symptoms, which include emotional numbing, avoidance of things that remind somebody of the trauma, dissociation, avoidance of talking about the trauma, or issues around it. There's also hyperarousal symptoms. These are the ones people oftentimes think about with PTSD. Hypervigilance, increased startle reflex, people being on edge, decreased sleep, anxiety, irritability. Next slide, please. PTSD can certainly affect relationships. People pull back. And some of the things that you look for, maybe the hypervigilance, the increased anxiety, people are really keyed up. And that can lead to decreased productivity and so forth. Next slide. Other anxiety disorders besides PTSD. There's panic disorder with or without agoraphobia. Agoraphobia is the fear of being caught in enclosed places or where you can't get away. It can even be in a public situation where you can't get away. There's generalized anxiety disorder. There's simple phobias. There's OCD. Certainly COVID-19, with all the focus on staying clean and keeping things clean, can really exacerbate somebody's obsessive compulsive disorder as well. Next slide, please. I think this is the important slide. What you need to hear is that all mental illnesses are treatable. And we do have effective treatments for most mental health conditions. And for the illnesses I talked about, PTSD, depression, alcohol use disorder, we have effective treatments. And somebody can get help. And the most common treatment is a combination of medication and some kind of psychotherapy, supportive therapy kind of treatment. And so we can really make a difference if people come and get help. And one of the things we need to do is get past stigma, because that's still a barrier that gets in the way of people getting in to get help. Next slide, please. Okay. Questions. I know I talked kind of fast. I covered a lot, but I wanted to leave some time for some questions.
Thank you. Thank you very much, Dr. Lehrmann. And you did leave us with some good amount of time, and we do have a few questions here.
So what kind of treatment works best? So it really depends on the illness, and it depends on the degree of the illness. But if it's a mild degree of depression or a mild degree of an anxiety problem, I would start with psychotherapy. I wouldn't start right away with medications. So talk therapy would be the best way to start. If it's moderate to severe, then probably a combination of medication with some talk therapy together would work best. And then the question was about helicopter parenting. I think, though it might be more challenging to try not to be a helicopter parenting when you're living in close proximity and your kids can't even go to school, as it's been lately, I think helicopter parenting does have its risk in that it can lead to children not being independent. They're going to expect mom and dad to protect them and or take care of them and find the answers for them, instead of them finding them and solving them for themselves and trying things on their own. So I think that's the downside with helicopter parenting. The helicopter parenting can certainly be very protective. And I know, as a parent, not wanting your child to get this horrible illness, you're going to be more at risk. You've got to find a balance and try not to be too much helicopter parenting, because otherwise your children are not going to grow up to be independent and be successful on their own. And that's what, ideally, I think what we all want. And that's hard. That's a fine line to walk for your child to become independent and not need you as much as they grow up. So I believe they're asking, what's the difference between post-traumatic stress disorder and borderline personality disorder, BPD? And there is a difference. I will say that individuals with borderline personality disorder oftentimes did experience trauma during their childhood and while they were developing, and they could have both. Somebody with borderline personality disorder, which is a developmental personality-based disorder where their personality develops in a way that they tend to develop unstable sense of self. They tend to have unstable mood, unstable and interpersonal relationships. They tend to view things as all or none, and they can have recurrent self-harmful behaviors. They tend to be impulsive. And it oftentimes the thought is, the theory behind it is that it occurs from abuse and or neglect during childhood, although it doesn't always have to be there. And so the treatment for borderline personality disorder tends to be psychotherapy over time, and then having corrective emotional experiences. So medications can help with some of the symptoms, especially the dissociative symptoms. Whereas post-traumatic stress disorder is a result of trauma as well, but it's trauma after personality has developed typically, and then the symptoms I discussed earlier are the symptoms of PTSD. PTSD would be treated with a combination of medications and that would focus on the specific symptoms. And I didn't get into treatment as much in this talk because I just didn't have time. And psychotherapy can also be helpful. CBT, cognitive behavioral therapy, and different forms of exposure therapy are very effective with PTSD. Both can be lifelong illnesses, though, and there are some similarities. The number of drinks per day that would be worrisome. So that's changing a little bit. When I went to medical school, it was typically up to 2 drinks per day actually was healthy. It actually decreases your um, high density lipoprotein, a healthier type of increases your HDL, your high density lipoprotein, which is a healthier part of your cholesterol. Um, and was thought to be healthy. My primary care doctor is now telling me I should only have 1 drink a day, and that more than that would not be good. So I think that's changing a little bit, but probably the general recommendation is 1 drink a day. It can be healthy, but more than that can start to be risky. So even if you went by what I had learned in medical school, 2 drinks per day, if you start to find yourself drinking 3, 4, 5, 6 drinks a day, as you start to go up during these stressful times, that's something to be wary of and watch out for that. So how do you inspire confidence to help somebody move forward from anxiety or depression? I think that's my interpretation of what the question is. I think that's hard. When somebody is depressed, they don't have confidence, and when they have a severe anxiety disorder, they're lacking confidence. I think oftentimes it's by working with them to help them see their improvements, and usually it's the people around them that start to see improvements first. So for example, I think with depression, initially they have no motivation to go out and do any exercise, but let's say they just go out and walk around the block, and even though they don't feel better, acknowledging that and saying, hey, that's a step up. Last week you weren't even walking around the block. And so I think to work with them and acknowledge some of the steps that they're taking to get up and get going. And around anxiety, I mean, it's actually nicely tied to their recovery, because oftentimes, so anxiety is a natural symptom that we all get when we're exposed to something that's dangerous or risky. We all get a surge of adrenaline. Anxiety makes us get ready. It makes us get ready for taking an exam, for facing something at work. It gets us geared up so that we're not falling asleep. So I think that helping somebody see their progress, and when you make progress and see that you can face something and get through it and get through it successfully, and then and then reminding them of that and letting them notice that helps build their confidence, which totally counters the anxiety. And so then next time they do it, they won't get quite as anxious. It's actually one of the techniques we use through exposure therapy that allows people to get past things that do make them too anxious. Gradually over time, they can see they can face something. Even though they get anxious, they can successfully face it and get past it. And the answer for that is, can telepsychiatry or telepsychology be as effective as face-to-face? I definitely believe that is the case most of the time. And I've done it personally, where I've done telemental health to the Iron Mountain VA, through the VA system. I was doing that 20 years ago. And initially I was very skeptical. I thought you had to be in the room with the person to really make something work, but it actually worked very well. And it's you need to use this tool and use it well, but it actually is very effective, and studies have shown that. So the question around that one that I would ask back is, are you talking about for somebody who personally has borderline personality disorder and how they should cope, or how somebody who's an acquaintance of somebody who has borderline personality disorder, how they should cope? That said, I'm going to try to answer it as best I can. I think something that helps people with borderline personality disorder is consistently caring and supportive relationships. People who are borderline personality disorder tend to be rejection sensitive, and as I mentioned, have unstable personal relationships. So providing them unconditional love and show support, even when we disagree or we're not happy with something they've done, to continue to be supportive and caring. That's something that I think is very helpful for them, and something that can make a difference for them. So just being consistent, being there, um, and, and being a supportive friend. Uh, I think the risk is sometimes, um, with having a relationship with somebody with borderline personality disorder, somebody can feel, um, kind of get kind of worn out because they need more reassurance sometimes. So trying, to make sure that you yourself are taking care of yourself if you're supporting somebody with borderline personality disorder, because they sometimes can ask a lot and need a lot of reassurance. So, practical strategies. First of all, with depression, anxiety, if things start to get unmanageable, get help. There's help out there, and don't be afraid to get help. Don't Managing your depression and your anxiety is a strength. Uh, about 50% of us in our lifetime will develop some kind of mental illness. If we ignore it and don't take care of it, that will be a weakness. If we actually recognize it and get help for it, that's a strength. So first of all, recognize it and get help for it. um, we all get down at times, and we all get anxious at times. That doesn't mean that it's a disorder. That doesn't mean that we need help, uh, to go for professional help. We all need help, friends help, and family members, that kind of support. So I think that's probably the most important tip I have. I will add this. Dr. Korkor is a big advocate for exercise. Regular exercise actually has an antidepressant effect and also helps with anxiety, and is a really healthy thing to do. And we all should try to do that. It's hard when you're depressed and you don't have the energy, but if you can push yourself to do regular exercise, that has a very strong antidepressant effect too.
That looks like it was the last question.
Well, that's good, because I think my phone is almost out of energy. So this has been a great opportunity. I appreciate Nick's helping me with the questions. I appreciate the audience's great interaction and great questions. Again, I'm sorry. I apologize for the quality of my ability to interact with you over my phone. My computer was not logging into this Ninja thing, and I just couldn't get in. So I apologize for that. I thank you all for participating and thinking about improving mental health. I thank Dr. Korkor and his foundation for doing this great work.
Thank you very much.